Morning, everybody. Thank you. Thank you for coming out in the rain, which apparently just started, 10, 15 minutes ago. But it's good for the district to have some rain. Sadly, it's going to go until tomorrow. But we shall persevere and try not to fall asleep with the gray weather. Thank you for coming back. Today is day 2 of the future of the nation's laboratory systems for health emergency response. Before I get to the agenda, I do want to say that in terms of our thinking and our comments today, or yesterday. Yesterday was a lot about the past. It's very easy for us as scientists to be very critical, to look back at our data and our experience and pick and identify gaps and shortcomings and so forth, all of which is important. But I want today for us to take that information and put it in context and sort of reorient and be looking towards the future. We're going to be talking about the future in terms of short term, where are we going in the next, year, 3 to 5 years even, and then be looking further out than that. If you find yourselves wanting to go over what's happened in the past for more than a couple minutes as you're framing your questions or making your comments, try and fight that habit. If you have to lean in a direction, lean forward. I think that's where we have to get to. Otherwise, we're just all going to be sitting around complaining for another day. And not to say that we were all complaining yesterday, but I want us to be future-oriented. I want us to be action-oriented. So here's the agenda for today. Here's me making my opening remarks and reflecting on yesterday. So you'll see the next session after this, we'll talk about short-term strategies to strengthen the nation's laboratory systems. Then we're going to be talking about a future model. I know some people already don't like the word model, but substitute with another word as you will. We just need to be talking about the future and articulating what it is that we want out of a system. Let's take as some baseline assumptions that, yes, everybody should introduce themselves and exchange business cards before the emergency happens. You don't have to say that anymore today. Yes, we should have relationships with people which actually transcend business cards and introducing ourselves to each other during the emergency. Relationships are about, we all know this, it's about investment of some time and effort and energy. And we're all so busy. I suggest to you that part of that relationship building time needs to be built into how we operate as a national system or systems of laboratories. And the third thing I would say is there are people in the room who have made it their business and made it their career to think about the future and then work backwards to where we are today so that we can figure out what we can do today and what we need to do today or need to get today to get to that future state. I think that's really important. It's about practical application. I don't want to, stomp on people's dreams, but as you're making your comments today, as you're thinking about the future, think about that too. How do we get back to present day so that we can develop those action items moving forward? So I think with that, I would like to invite panel number 2, session 6, short-term strategies to strengthen the nation's laboratory systems for public health emergency preparedness and response. Thank you.